the balance of very good quality of vision, but with minimal side effects. And that's what I would say is a premium outcome. Unfortunately, with most of these lens technology in how they're actually based, often they will give you a lot of unwanted side effects. One thing that's very unique with the FEMTIS technology is that the lens itself has, in addition to the haptics, which most lenses has, it has 4 flanges around the optic surface. When we do the surgery with the FEMTIS lens, once we put the lens inside the capsular bag, we then elevate the lens, so we clip it into the capsulorhexis. You can fix the toricity exactly at the point at time of surgery, so the lens does not move there as the capsular bag may contract or change from healing responses over time. And this gives you a very predictable outcome, not only in the short term, but also in the long term as well. So in fact, this is one of the few lenses that's available on the market that actually give you no chance of getting negative dysphotopsia in patients undergoing routine cataract surgery. Obviously, one of the key things about using the FEMTIS is basically doing a perfectly round capsulorhexis. The advantage of using robotics or using lasers is that you can get consistency on every single patient itself. And in those cases where you may have to remove the centration in respect to angle alpha for positioning of the lens itself, you can then basically adjust that on your laser system, so you'll get that perfect centration in those cases as well. And so you combine the technology of the laser with that of a capsulorhexis clipped IOL to ensure you get a perfect outcome. As the bar is now being raised with this technology of effectively linking the effective lens position and providing distance intermediate near vision, in future looking at outcomes that we call basically patient-reported outcomes or PROMs will become much more of an important task. And this is exactly what we do now for refractive surgery, and I think this will come into IOL surgery as well.